welcome to the sports therapy lecture. It's so weird being on Zoom. I'm like, I'm just right here. This is Allie Lait. He's our equine dentist today. Dr. Andrea Smith's just finishing up, and she'll be upstairs in a little bit. So if you see her, if you do have any questions or comments, you can put them in the chat button, and we will field them at the end of the lecture. So just at the bottom of the screen, there's that little chat button. If you can't hear us very well, if you have any issues, if you have any questions, just put them in there, and then we will get to them at the end of the session. Okay, we're going to let Allie start.
All right, here we go. Thanks everyone for joining us on our dentistry lecture and our first of our performance horse lectures for the year. So I'm excited to share this information with you. It's something that I'm very passionate about, and I feel like the horse's mouth sometimes feels a bit of a mystery to us because we can't see their teeth on a regular basis when from the outside anyway when we're looking at our horses. So we're going to try kind of reveal some of that mystery for you, answer some questions, and just help give you a little bit of understanding of what's going on beneath the surface in your horse's mouth. So I'm Allie Lait. I've been doing equine dentistry for 12 years now. I've graduated from the Texas Institute of Equine Dentistry under the instruction of Reidinger in Weatherford, Texas. After graduating from my dental course, then I also went to Olds College the next year and completed the Animal Health Technology program through Olds. So I've been working here at the Energy Equine Clinic since I started doing the dentistry, so about 12 years now, and as well as working out of a few other clinics over the years. So I'm just really excited to share this with you today. So I'll give you a little bit of background on how I got into the dentistry and my involvement with the horses too. So I grew up in both rodeo and ranching family, and so horses were a huge part of our life since I was a little girl. I had the opportunity to rodeo at a really young age and compete. My dad worked on a ranch and started a lot of young horses, so I got to see both aspects of the horse world, the working with the young ones and the everyday working life that the horses do for us, as well as that competition side. So I got a good understanding of what we're asking our horses to do, and help you relate this information with their teeth to your horse's performance. So I'm going to share some of my personal experience and the knowledge I've gained over the years through my education and just working with the professionals here, and what I've experienced myself in how the dentistry can make a big difference for your horse. So I'm going to start off by, I guess, giving you two different approaches to the dentistry. We need to look at things from a health perspective to make sure that our horses are chewing properly, that they're maintaining their condition. Their digestion is very important, and the first step into their digestion is how they chew their food. But we also want to go into the performance side of things. So from a basic point of view, the health of the horse's mouth is going to have a huge role to play on their overall health through the rest of their body. But then beyond that, there's a lot of things that we ask them to do that they wouldn't do in their natural environment, and that's including manipulating the mouth, the way that the tongue, the cheeks, and those teeth interact when they have a bit in their mouth. So we're going to start off with the very basics on how the horse's mouth works, and then work our way through the common problems that can develop in your horse's mouth, how we make those corrections to keep them balanced, and then relate that to the performance of the horse. So we're going to go right from start to finish and hopefully connect some dots for you. It's most important to understand how the horse's mouth is really designed to work. I'm asked a lot, why don't we ever have to float wild horses' teeth? They get along fine, so why are we floating our horses' teeth on a regular basis? And so we'll go through right from the beginning here, how their mouth works, and then start putting all of our pieces together. So there's probably one of the most important factors in a horse's mouth is that when they're really designed to self-maintain, keeping the teeth in balance, the function of their Tmj, that's the joint where the jaw will attach to the skull, and the balance and use of incisors, that should all stay in an even balance throughout their life. So in a wild environment, our horses are grazing anywhere between 16 and 20 hours a day. So they're spending a majority of their life with their head lowered down to the ground. When they have their head down low and they're eating grass, their jaw is actually in a position where all of the teeth match up one over top of the other. So we have a nice alignment of all of the molars as well as the front teeth. When they lift their head up, their jaw will slide backwards. I'll try to keep these teeth in alignment so you can see them a little better. But there is somewhere between 1/4 to 3/8 of an inch of forward-backward movement in their jaw while they lift their head from the ground up and down again. All of the movement of this horse's jaw right from the beginning, the front of their mouth to the back, is happening way up here behind their eye. So we see a lot of movement in our horse's mouth down below, but we sometimes don't recognize how far that movement travels and starts way back here in this small joint. So this joint is really designed to stay healthy its entire life. When they're feeding all day long through every day of their life for 20 years and plus, then this joint is designed to stay healthy. It has a very thin meniscus pad. It's like a cushion between these bones to help keep that joint lubricated and cushion the friction of these bones against one another. We're going to get into a little more detail of how the teeth will affect the movement of this joint when we get a little further along. But it's important to understand where the movement of their jaw comes from. So this forward-backward movement all day long throughout their life is really what helps keep their teeth level from front to back. We're going to have a little closer look here at how these teeth should stay in a fairly level height of chewing surface. And so when the bottom teeth are able to work back and forth across these upper molars, that's what's keeping things level from front to back here. The other movement that the jaw makes that's a little more obvious to us that we see on a regular basis is the side-to-side movement. Now, a horse will chew on one side of its mouth at a time, switching back and forth on usually an even rate. They'll take, let's say, 10 strokes chewing on one side here. They'll move their food over to the other side of the mouth and then chew over on this side. So a horse will chew in a circular pattern. They're going to drop their jaw down to the side, back to center, and make a nice little circle here. Then he's going to switch his food over to the other row of teeth and work back and forth on a circle here. So I'm going to show you on our diagram the effect of that circular pattern. When we look into a horse's mouth from the front, looking straight down into his row of teeth here, we'll notice that we have an angle to these molars. So that circular pattern of the jaw where they drop down and back up to center is what helps develop this natural angle on the chewing surface. So their teeth aren't sort of flat like ours. They don't chew up and down, but that circular pattern develops this natural angle to the molars. That's what will naturally keep the outer edge of the teeth more in level as well. So we can see when I hold the skull up to the camera that these upper teeth are sticking out quite a bit wider than the bottom teeth. I'm going to open them up here for you too. So the actual width of these teeth, these lower molars, are considerably narrower than these wider upper molars. Hold this one here for you. We have quite a bit wider surface to these upper teeth. Plus, the row of teeth on the upper molars makes just a nice gradual curve, where the bottom teeth are in a pretty straight row front to back. So that difference in width is there to help the grinding motion. Get my hand stuck in here. So those bottom teeth will actually work back and forth against those upper molars as they chew. So when they're chewing in their circular pattern, down to the side, back to center, we're getting a nice even angle to the teeth. And if we have a full grinding stroke, This guy moves a little further than your normal horse would when he's got some muscles and ligaments and skin, but going all the way to the side back to center is what's going to keep these edges worn even. Set him back on here. I'm going to keep track of my notes here so I don't get on a tangent, but I think the next part that's really important in this balance of this horse's teeth is in a wild environment, they're nipping grass every day, every bite they take. They have to use their incisors. So their incisors are these front teeth that we see on a regular basis when we lift their lip up, and they need to nip with the front teeth in order to grind with the molars. So there's a pretty considerable difference in the horses that we have domesticated. Majority of our horses eat hay, maybe more than grass, depending on the availability of pasture for them, on their training schedule, their competition schedule. They're eating eating hay more than grass. Where a wild horse is eating grass majority of the time, really that's all that he eats, and he has to nip with these front teeth in order to chew with the molars. So he's keeping a very even rate of wear and use of the front teeth in relation to the back teeth. I'm going to get into the details of that here in a minute. So this gradual forward-backward motion of the jaw, the nipping with the front teeth, the grinding with the molars, is what keeps those teeth wearing level throughout the horse's life when he's in his natural environment. So we've made a pretty considerable difference to a horse's lifestyle. For the ones that we have, that we ride anyway, even the horses that are only used part of the year are still not in a completely natural environment. So we definitely have some influence on how their mouth is working, how they're using their teeth, and influencing the balance of these molars. So I talked a little bit about the movement of this joint, of this TMJ up here. TMJ stands for temporomandibular joint. So when you kind of hear people talk about the horse's TMJ, sometimes I hear clients will say, my horse has TMJ. Well, every horse has a TMJ. Sometimes we're referring to a Tmj syndrome or some disease of this joint. And because it's designed to have a full range of motion, side to side, forward, backward, throughout the horse's life, this joint should stay fairly healthy from birth right to death. But like any joint in our body, if we have limitation of the range of motion, we're going to see some disease process starting, usually in the form of inflammation, leading to some change in the surface of the joint and change in lubrication of the joint. So when we start manipulating or having influence on the balance of the teeth from front to back, we're going to be influencing this joint as well. So our goal in floating our horse's teeth, really in the big picture, is to help maintain the full range of this joint so we can ensure even rate of an eruption from the front of the mouth through the molars and keep even pressure on this joint and range of motion here. When we get an imbalance of use and wear of these teeth and an abnormal wear pattern, that's going to restrict the full range of motion of this joint, and we start to see adverse effects down the road. So we'll talk a little more about the function, the composition of the horse's teeth, how it differs from ours. Then we can get into some of the issues that we see on a regular basis in our domesticated horses. So just go back here. So when we, I think important to just recognize the placement, the eruption and the wear of the horse's teeth. This skull that we're looking at here is from a 2-year-old horse. We'll look at a skull from an older horse here in a minute and see some differences. So the whole size of the skull is quite a bit smaller than our older skull here. I'm going to hold him up to compare. Actually, slide this guy forward here. We have quite a bit difference in size. Now we're going to say this is about a 10-year-old, 12-year-old skull, a 2-year-old. So it's just like us. We have to have some room for the skull to grow and for those teeth to develop. Because of that, part of their teeth come in as deciduous teeth or baby teeth, and they will shed those teeth before their permanent molars and incisors can erupt to accommodate the growth and change through the younger years of the horse's life. So our horses have, this guy won't have all of his teeth to show you, but we can look at this one. He's had a little wear and tear. So our horses have 6 incisors, 6 front teeth, top and bottom, as well as 6 molars, except for this guy. We're going to look on this side. He got in a bar fight, lost a tooth. We've got 6 molars through the rear part of the skull. We call the first 3 premolars, the back 3 molars. So the first 3 molars actually come in as baby teeth, which they'll shed in a consecutive pattern. We'll get into that in a second. The back 3 come in as permanent molars. Now, all of their incisors, all of their front teeth come in as deciduous teeth, and they will shed them in a consecutive pattern, and the permanents will follow in. So I'll talk about the time frame that they're changing in a second. One of the next important parts to recognize in the horse's mouth is his wolf teeth. Now, I'll bring this up a little closer so you can see on the screen. The wolf tooth is going to sit right in front of this first molar. It's just a small remnant of a molar that was maybe there years and years ago that can't really explain to you the changes that's happened over time, but this little tooth really doesn't have a function like the molars do, because it is sort of sitting out there on its own, often has no tooth in opposition to it, and so it's in a spot that interferes with the horse's performance when we have a bit in his mouth. And we'll talk about why we take them out in a little while. The canine teeth are the next ones that you regularly see on your geldings. Now, the wolf teeth and canine teeth are often confused because the name is sort of similar. So the canine teeth are the ones that sit right behind these incisors. You see them when you're putting the bridle in his mouth. Usually they get, the older the horse is, the longer those teeth are going to get. So the canine teeth generally only find in the male horses because their purpose is really only for fighting and self-defense. In the wild, those teeth will get longer over time, erupt a little more out of the skull and get a little sharper, which really has to do with the dominance of the older stallions in the wild compared to the younger horses. So if we find canine teeth in a mare, they're generally very small and don't have the same purpose that they have for the male horses. So sometimes we get some confusion that mares don't have wolf teeth when we get the wolf teeth and canine teeth confused. So those canine teeth, the ones that you really see at the front of their mouth aren't serving a purpose necessarily for their digestion and their eating or really anything for performance. They're just there for a self-defense mechanism in the wild. So we can actually shorten those teeth to a safe in a safe amount to keep them from rubbing on the tongue and the cheeks when they have a bit in their mouth as well. But the wolf teeth are the ones that we will remove generally before the horse is ridden. So there's often some confusion there. But the mares can have the wolf teeth as common and often as the geldings. And often those wolf teeth are taken out when the colt is gelded, but unless we're checking for them in the mares, they're often missed. So sometimes those mares, fillies are started at a young age, start riding them, and those little wolf teeth can actually get fractured, but they don't come out of their mouth because the gum tissue can still hold them in place, but we get a little fracture of that tooth above the gum and causes them a lot of pain and discomfort. And we'll get into that a little bit more when we talk about the performance of the horse, but important to just recognize where that little tooth is way at the front here. So when we talk about the caps and the change of the shedding of the baby teeth and the eruption of the permanent teeth. When the deciduous tooth is ready to shed, when that horse is ready to lose his baby teeth, we refer to that tooth as a cap. So those caps will start to shed at the first set at 2.5 years. So this horse, this skull in particular, hasn't lost any of its baby teeth through its molars quite yet, but I'm going to show you a skull that is showing some change of teeth as well. So I'm going to set him aside here. Those caps or baby teeth will shed on a 6-month basis between the age of 2.5 and 4.5. So we see a lot of change in our young horses. I'm going to set this guy up here. Now these first 3 molars, like I said, the first tooth, they'll shed the cap on the front molar at 2.5, and then 6 months later, at 3 years old, they'll lose the second molar. At 3.5, we'll lose this third molar back here. So we have 6 molars on the bottom, 6 on top, and all 6 of these incisors that they will be shedding. The caps have permanent teeth coming in and a lot of change, 24 different teeth that are coming in and out between the years of 2.5 and 4.5. So I'll show you how a cap actually sits on these teeth here. Coincidental that this horse still was just about to lose his caps, and we're able to see how these baby teeth actually change. So when this deciduous tooth is still young, before the permanent is developed, we have a considerable amount of tooth above the gum line that we can't see that is gradually being worn away from the chewing surface. And as this permanent molar is developing, it will actually help dissolve the root of the baby tooth as well. So once that process happens, we just have this thin little layer of tooth left. That's all that would remain of the baby tooth, which we'll refer to as the cap. So once this cap is ready to come off, it actually gradually gets loose as the horse is chewing. It will eventually come right off, and we have this nice permanent one coming in behind it. When we talk about getting to the performance part of the dentistry, we'll explain how these caps really interfere and cause discomfort while the horse is being ridden until this cap sheds and the permanent one can erupt. But I wanted to be able to show you the difference in permanent tooth and what this cap looks like when it comes off, because we hear reference to the caps, but it's hard to really get a good grasp or understanding of what's happening in your horse's mouth when you don't get to open it up and look in there. We're going to compare that one to his bottom jaw. So he had already lost the caps on the bottom on these second molars, so we can see it's considerable difference in height. The permanent was erupted through the gum. We have a fully erupted permanent tooth here, but still a deciduous tooth, baby tooth that's not quite ready to shed. So this gives you a good idea of that process of change of those teeth through their 3-year-old year. Set him back up here. So then in order to understand why we're actually floating or filing our horse's teeth, we're going to look at how those teeth are developed, the composition of them. So they're very similar in ours to the point where they're made of the same substance. But the main difference is that our teeth are coated in enamel, and then we have cementum and dentin on the inside, which are softer substances. The horse actually has a band or ribbon of enamel that weaves back and forth through the tooth. Now, I'm going to try bring this up to the screen so you can see a little closer. And if not, I'll draw you a little picture to help make it make sense. But when we look at the surface of this tooth, the dark spots that we see here are dentin, so they're the softest substance, and the reason that they're dark like this is that substance can stain a little more easily than the cementum and enamel. So these little dark spots in the chewing surface aren't any sign of decay or anything unhealthy. It's just that they show up a little bit darker, but it helps us recognize the different parts of the tooth. The cementum will also fill in around these little dark spots, and it's a little hard to see on your screen, so I'm going to draw you a picture of these different layers as well. But our enamel actually weaves around the edge of the tooth, but also back and forth across the width of the tooth. And it's a very thin, sort of like a ribbon that will go back and forth, but also run the whole depth of this tooth. So I'll show you what the surface looks like and then how this tooth actually is designed to wear over the course of lifetime. I'm going to make a quick little squiggle for you. Okay, so I'll see if I can roll this up a little bit closer. A little bit of the challenge of our technology. You can't see the tooth in person. Can you see that okay on your screen, Louisa? Yeah. Okay, so our dark little line that wiggles back and forth across this tooth would represent the enamel. So we're looking at the actual chewing surface of the horse's tooth here. We're going to have a layer of cementum that also fills in around here. This isn't going to be exactly to scale, but I'll try to give you a bit of a visual anyway. And we have a few spots in here, generally roughly, of our dentin, our softer substance. So that enamel, when we look from the side, is we will just see in a long tooth if we're looking at a side view of a molar that would be taken out of the horse's jaw, we're really just going to see where that enamel would fold back and forth across the width of the horse's tooth. Where that enamel comes to a point and begins to work its way back across the surface of the tooth, we'll start to get a little point that develops on the side. Now, those enamel folds are designed to help the horse grind and shred its food. In our domestic horses, I'm going to explain how those ridges can actually get more advanced than they normally would be in a wild horse and how they lead to some issues in the horse's chewing and movement of his jaw. But understanding that their composition of their tooth is a little bit different than ours eases a little bit of that concern that we're filing on their teeth. So their tooth is designed to gradually wear away on the chewing surface every day while they're chewing, and they have a reserve or a lifetime worth of tooth that we can't see below the gum line that gradually comes up to take its place. So when all throughout the horse's life, it has a gradual amount of abrasion on the chewing surface, gradual remodeling of the jawbone beneath the tooth to help push it up into place to fill in for the tooth that's being worn away. So in our young horses, they have a considerable amount of tooth below the surface that we don't see inside their mouth. Then in our older horses, that tooth is actually being gradually worn away. So we have a limited amount of tooth for that horse to use throughout its life. Now, our main goal in fluting their teeth is to help maintain an even amount of wear and abrasion so that certain teeth aren't getting worn out faster than they should and essentially limiting the lifespan of the horse. We'll get into a little more detail of that, but I'll explain a little bit of give you a bit of visual of how much tooth a horse has and why we actually file the sharp points that develop. So this long tooth here would have, I'll try to hold it up so we can see some comparison here. So I kind of hold him like this. This would be a tooth that was extracted from approximately a 9 or 10-year-old horse. I'm going to hold this one up aside. Actually, probably helps if I hold it closer to the screen for you. I'll hold a tooth beside here that would be from a approximately 15-year-old horse. We'll turn him around so he's going the right direction. And then a tooth that would have came out of a 20-plus-year-old horse. So the little red line that you can see just kind of below the surface of these teeth would represent where the gum would be when we look inside the horse's mouth. And then everything below this red line is showing how much tooth they have beneath the gum line at those various ages. So they have really in these younger horses, if we were looking at a 5-year-old horse, would probably have even a little more length to this tooth. Once these teeth are the permanent teeth fully erupt out of the horse's jaw, there's actually about a 5-year time frame where we do get some additional growth to the tooth as the jaw grows. There gets to be more room for that tooth. So we will see some I guess expansion in length of these teeth up to around 7 years of age for sure. In some cases a little longer than that as well, depending on the amount of wear and abrasion of these teeth too. So I will show you in our young horse here. We can see on the, hopefully you can see, where I have a little line drawn across this horse's tooth. That's going to show where the gum line would have been while he had all of his tissue. I'm going to slide him open here. Leave this little guy will come right out. In a 2-year-old horse, he has that much tooth below the surface. So there's a considerable amount below the gum line all the way down to the bottom of his jaw. So that also explains when you see a bit of a bump underneath your horse's jaw, and often in his 3-year-old, 4-year-old year, it's really just the jawbone making some room for that permanent tooth to develop until the cap comes off. As that tooth begins to erupt, this jawbone will remodel and close in behind and help with that eruption process as the chewing surface is worn down. Set him over here. So understanding that those teeth will gradually continue to erupt helps us give a better understanding of why we need to help that horse keep his teeth born a little more level. So we recognize that in a natural environment, he has full range of motion of his jaw. He go forward, backward, side to side, nip with the front teeth, grind with the molars, keep full range of motion of his TMJ, and maintain a balance of his teeth all throughout his life. So I think understanding that will make more sense on why our domestic horses are needing a little bit of help to do that job. So we've obviously changed their natural environment. We've influenced what they eat, how often they eat, how often they chew, or how long they chew and grind, and how often or frequently they use the front teeth nipping grass as opposed to just picking it up with their lips when they eat their hay. So I think that change in environment is really the first reason why our dentistry is necessary and essential. I like to compare it to trimming their feet just because it makes it, gives you a little bit of relevance in just the general maintenance and husbandry of the horse. So filing their teeth really just becomes, like I guess necessary care to help them do what they're not doing when they're not in their natural environment. So the change in feed, I think, has a lot to do with the abrasion on those teeth. When they're out in the natural environment eating grass all the time, there's silica in the grass. It's an abrasive component that helps those enamel ridges wear at an even rate. Now, the enamel in their teeth is the hardest substance in their body. It's even harder than bone. And then the cementum and dentin that fills in between that enamel is considerably softer. So the way that those ridges interact as the teeth go side to side will determine that natural wear of the teeth. Now, when my red pen here, when those ridges interact and the jaw can slide forward backward, there's always some abrasion of those enamel points against one another. Now, when we have our horses in a confined environment, whether they're living in a paddock or have restricted grazing, maybe they live in a stall most of the time if they're a show horse, then they're really limiting the time of day that they're spending with their head lowered and that forward backward movement of the jaw. So what starts to happen is the enamel points in their teeth that we see in that folding of enamel on the chewing surface starts to interlock. Do our little points kind of show up on our screen? Maybe I can move it a little closer if need be. But we get, I'll draw this a little larger so we can see on the chewing surface. My squeaky pen. If the horse is only chewing side to side, his enamel points become more exposed and corrugated. So he's really only chewing on the same spot, side to side, but lacking that forward backward motion that would naturally keep those points worn fairly even. And so before I get into explaining the corrections and problems that we start to see once this pattern starts to change, I'm going to touch on a few issues that go along with that, I guess the grinding of their teeth and that gradual grazing all throughout the day. So a horse's stomach can't break its food down any more than it's chewed up inside their mouth. So when we see a change in the natural wear pattern of their teeth, then that's going to restrict especially when we're talking about the restricted grazing time that they get, or even eating only a couple hours morning, couple hours in the evening, that's really limiting the amount of time that they're grinding. So two things we see internally that we see a result of that change in natural environment. When they're grazing all day long, they are producing saliva while they chew. So they only produce saliva when their teeth are stimulated. When they're chewing up and down, that stimulates those salivary glands to work. That's natural salivation all throughout the day is what buffers the acid in their stomach. And I'm going to have when Andrea joins us, I'm going to have her talk a little bit about the prevalence of gastric ulcers that we see in our performance horses, and often that is kind of related to stress and performance. But maybe one of the things that we overlook is that our domestic horses aren't spending as much time during the day grazing, so they're not salivating all day long like they would in that environment. That limits the saliva production and the amount of saliva in their stomach, raising the acidity or lowering the pH in their stomach, which can lead to those gastric ulcers. So that's a little bit of a side note that we're going to touch on a little bit later. But also the gradual grinding of their teeth all day long is also going to help with that stimulation of digestion too. So those are the few things I just wanted to kind of keep on the back burner before we get into the corrections that we're going to make. So if I don't mention it now, I'm going to forget later for my own purpose too. So we're going to talk a little bit more now about how that changing in wear of the teeth leads to some issues that we actually correct when we're floating their teeth. So I'm going to, I think we can see this okay. Louisa, you let me know if we need to make anything larger if you can't see it on your screen. Perfect. Okay. Everyone's keeping up with me all right here? So we'll get into these changes that we see in the chewing surface of the teeth, an imbalance of pressure from that change of environment. Now, this would represent So this little corrugated pattern that I've drawn is going to represent the enamel ridges that form along the chewing surface of the horse's teeth. So as I mentioned, every time that the enamel will fold back and forth across the molars, that's where we'll see a sharp point develop. And our most, I would say one of the first changes that we see in the wear pattern of the horse's teeth is this overexposure of those enamel ridges that creates this corrugated pattern and starts to create a little bit of a gridlock. As these sharp points start to interlock, that's going to limit some of the forward-backward motion of their jaw as well. They're still chewing side to side, but as that happens, they're really almost sharpening those edges of their teeth because these grooves become a little deeper and those enamel points become more exposed. Often when those points get very sharp, they're rubbing along the horse's cheeks. As I mentioned before, those upper molars sit wider than the lower molars. When we look at this diagram again, as we look down the center of the horse's mouth, this is going to show the alignment of the bottom teeth in opposition to the upper teeth. So we can see that there would be almost 2/3 of this upper molar exposed against the cheeks when the horse is at rest. When he starts to chew, this tooth would slide back and forth against that upper molar, but that also means that it's dragging the cheeks against the points on these upper teeth. So as those edges get a little bit sharper and they want to protect their cheeks, they're going to limit how far they push their jaw side to side when they chew. That creates a bit of a vicious cycle where the edges are now not being worn as level as they would be if they had full range of motion of their jaw. The result of that will be some points that hang down these outer edges where the bottom teeth aren't traveling all the way across to wear away, as well as a little sharp guy here. And we'll start to see that process develop as young as 2 years old in those horses who maybe eat, even if our young ones are eating off a round bill where they're chewing constantly throughout the day, but maybe chewing with their head a little bit higher, not getting that forward-backward motion and nipping with the front teeth. So that once that process starts, we're going to see this chain reaction of events and result of the balance of their teeth. So our next most common, what we call malocclusion or imbalance in their mouth that we see is if they're spending more time during the day with their head raised up rather than down, and that jaw has slid backwards, then we're going to see a difference in opposition of those teeth. So that would mean that the very back portion of this lower molar is not in direct opposition or contact with the back portion of the upper one here. So we get this little point of tooth that doesn't get worn away. Often the same thing happens on the front tooth on top. So we can imagine that as the jaw slid back a little bit and the misalignment or opposition of these molars is going to allow everything between these points to wear away as the horse chooses to decide, not a forward-backward movement to wear these little sharp points on the front and back. When the jaw's in that rearward position, the same thing will happen with our front teeth. So we might have a small section of this upper tooth here that's not in opposition with the bottom one, as well as a little bit on this back corner that gets a little bit higher. So we're seeing a misalignment in the wear pattern of those teeth. Once that pattern starts, it's going to continue to advance until we can help make a correction for them. Once we have those little hooks there, they're also contributing to a restriction in the movement of the jaw. So now it's I guess that they still have side-to-side function, but losing this forward-backward movement. And then the next thing that we start to see are the grooves getting a little deeper. So we have, I'm going to make this exaggerated so you can see it a little better on your screen. We have some interlocking of the chewing, of the enamel ridges on the chewing surface. Now we recognized at the beginning that those upper molars curve out a little bit wider, and the chewing surface itself is wider on the upper teeth, where those lower molars are a little closer together. The widest part of that curve in the upper jaw is this middle or third molar right here. So where this, if those lower teeth aren't traveling all the way across side to side of those upper teeth, because now he's protecting his cheeks from those sharp points, we start to see a lack of wear on the inside of our middle molar here. So this lower molar is going to get a little higher than it should be. That's also causing some excessive pressure on the upper tooth. So we get a little high spot in the bottom, a little low spot in the top. That's the beginning of what we call a wave. Now we've already established this pattern where he's maybe has a little more restriction of the forward-backward movement, chewing side to side, but maybe not full range of motion side to side to protect his cheeks from those sharp edges. That's causing those sharp points to become even sharper. And over time, we start to see almost a steeper chewing surface from the lack of side to side movement. So we get these points a little more prominent. And we get a little higher spot through the middle, a little more significant wave. And then we get a mirror image of that wave happening on the upper teeth. Our next, probably more severe correction that we start to, or a problem that we see that we need to correct when this is allowed to go on over a long period of time, even in like a several year period, you get an protrusion of our upper molars on either side of this wave. Oopsie. Our hooks get a little larger, because now they're not getting worn off. We get a change in wear from our hooks causing some excessive wear behind this upper molar. On the front of this lower one here, it gets worn down. When this pattern is allowed to continue over time, we do often see these longer teeth get to the point where they've worn the opposing tooth almost to the gum. When they've started to lose both side to side and forward backward movement of the jaw, then we start to see the results of their jaw going up and down more than side to side. That will start to cause some packing of feed between the teeth. We get some disease process happening, so gingivitis basically. We see a change in the health of the gum tissue as a result of feed getting pushed down against that junction of tissue against the tooth. And once that feed is packing, that can cause a harbor of bacteria, which in a severe case could lead to some abscess. So we start to see in our lower spots where those teeth are getting too long, some unhealth in the tissue and some feed packing in these spots here. So it's a little hard to see my picture, but getting the idea. Now, once things get to this point, it makes it very difficult to reestablish that natural balance of pressure because we can't correct it all at one time without compromising the horse's ability to grind and chew properly. So I really want to kind of, I guess, explain a prophylactic approach to our dentistry and explain why some regular maintenance of their mouth is going to help them in the long run, preventing their mouth getting to this point where we have to make several corrections in a short time frame rather than just maintaining a healthy balance from a young age. I want to talk a little bit too about the change that we see in their incisors as a result of this wear pattern in the molars. So I mentioned that we get a lack of wear on these points of the front teeth. I'll make this drawing a little bigger so we can use this diagram here. So when the horse is nipping grass on a regular basis, he's keeping an even amount of abrasion and wear through the center of these front teeth here. When he's chewing in a circular pattern, the motion of these bottom teeth coming back to center will keep the corners more level as well. So the horse in a natural environment is going to keep a nice horizontal plane to the front teeth, as well as a fairly shallow length or depth of tooth that we see below the gum line, because they're using them constantly all day long, as opposed to our performance horses who are lacking that wear and abrasion. So the result of that change in environment, we usually first start to see a little bit of a curve to the teeth. You might see a little bit of length through the center ones. Make this a little bigger so you can see. I'm going to exaggerate this, so it's going to be a more subtle change we see on a live horse, but it'll make it easier for you to see on the screen here. Ken's kind of dying on me. That's going to cause some excess wear through these bottom ones. Now, because he's still chewing in a circular pattern side to side more than he's nipping with the front, with these center teeth, we're going to see a little more wear on these corners than we do through the center. That change will result in, let me do a little switch here. It just gotta work. We start to see some excessive wear on the upper corners and a lack of opposition on these lower corners, which we refer to ventral curvature, or basically a smile. Also, with the lack of forward-backward movement and lack of wear through the center of these front teeth, over time, we get a steeper angle wearing through these front teeth here as well. There. So our front teeth do continue to erupt just as much as those molars do. And it's in a total relation to the amount of wear that those incisors receive. So we do often see some excess length of those teeth from a lack of wear, but sometimes the corrections that we're making on those incisors is not necessarily about changing the length or shortening the teeth, as much as helping to correct this steep angle that develops from the lack of forward, backward, and nipping motion with these front teeth. And now, I think when we talk about the angle of the front teeth, there's a common misconception that we're referring to the slant that you would see when you open your horse's mouth this way at the front. Let me make a little bigger picture so you can see better. I'm going to slide this over a little bit here. So, little exaggerated view of his front teeth here. Often there's a misconception when we talk about the angle of the front teeth that we're referring to this angle on the front surface against their lips. That's naturally going to change over time, because as these front teeth erupt, they have to be curved to fit into the shape of the skull and the jawbone. And so as the teeth erupt out of the bone, we're going to see a different angle based on the curvature of that tooth. So when we refer to changing the occlusal angle or table angle of the horse's teeth, we're talking more about a steep angle that will develop just from a lack of wear on the front portion of the upper teeth and the back portion of the lower teeth. So we're this bit here and this bit here. If the horse naturally has forward-backward movement of these teeth, they're going to stay, that ankle will stay quite shallow. So the ankle we're referring to is the difference between the jawbone of the horse and the chewing surface of those molars. So by helping that horse maintain a more natural shallow angle to the surface, we're helping allow his jaw to travel more freely forward backward and reestablish some of that natural movement of the jaw. So before I get into how we make those corrections, there's a few other kind of issues, we'll say problems that develop through those incisors that can interfere with the movement of the jaw and the balance of these teeth in the back. More often than you might expect, we'll open a horse's mouth and find that he's missing a tooth. Sometimes more often on the incisors than the molars. That can happen from some trauma at a young age, or maybe just a problem with the development of a permanent tooth. So, let's get rid of this little smile here. If we open this horse's mouth and we find that he is missing this upper corner, for example, now there's nothing for this far corner tooth to wear against. It's going to erupt at a faster rate than the ones that have opposition. Any one of these, whether it's the molars or the incisors, are going to erupt until they have opposition. So in a case where we're missing a tooth, the tooth without opposition can continue to erupt to the point where it's touching the gum on the upper or lower jaw. So if this tooth naturally gets higher because it's not getting any abrasion, we're going to gradually see this tooth get worn a little bit shorter. Let's get rid of this here. Now, because of this gradual slant that will develop over time, it's going to be easier for the jaw to slide to this horse's left, but restricted when this high point hits here. He can't chew as much on his right side. That gradual change in wear and chewing only on this side is going to limit the amount that this side gets worn. Right on my squeaky pen. And it's not too long before we have a big slant in our horse's incisors. Now it becomes easy for this jaw to gradually slide to his left, a lot of restriction to the right. We then start to see more use or more chewing on that far side of his mouth, on his left side, and that's going to cause these problems to get more exaggerated, where the side with lack of wear due to these change in pressure of these front teeth is going to almost preserve the other side of his mouth. So we start to see this imbalance and disease process happen even faster when we have this angle or slant, or what we call a wedge, develop in the incisors. One of the other common things that we might see with the front teeth as a result of some cribbing is the opposite of a curve. We get a ventral or dorsal curvature or a frown. We're going to just tweak this guy here. If what we typically see in the horses that maybe have a bad habit of running their teeth on the fence, maybe before feeding time, or the ones that are chronic cribbers, is they will wear excessively those front central incisors and cause a lack of opposition of the bottom. So as we get that process started, he needs a corner tooth too. Put him back in there. Whether we have a smile forming or that frown, dorsal curvature, we're starting to limit how far the teeth can pass one another before these high points start to hit. That's going to restrict how far the bottom molars can travel across your upper molars. If we have, in that case where we have a slant or wedge, let's say he's getting more of a high spot on this side, a little longer over here, and shorter through here. Now this horse can chew on this side of his mouth, where these points off at a natural, little more natural rate, but the lack of use on this side is going to allow these points to get even longer. From a lack of side-to-side movement, that's making it difficult for the horse to chew evenly, and he's going to favor one side more than the other, causing these problems to get worse faster. So we're starting to paint a little bit of a picture of this process that gradually happens over time. We can see a pretty considerable difference in the horses, even as young as 2- and 3-year-olds, that live in a corral and eat off a round bale, as opposed to the ones that get to live in the pasture in those younger years. And then that change in wear pattern at that young age is setting them up for how that mouth is going to wear and erupt all throughout their life. So we're going to talk a little bit about maintaining an even balance in their teeth and how we can make a regular maintenance plan for them to prevent this from happening. Once we get to this point, then we're having to make some larger corrections at one time to enough range of motion to reintroduce that balance in pressure throughout the horse's mouth. Now, we touched a little bit on the function and movement of the TMJ and how this joint, this guy here, how all the movement in the horse's jaw comes from this joint here. So naturally, when we start to get the restriction that we're seeing in these diagrams, we can imagine how much that's interfering with the movement of the jaw here, limiting both side-to-side and forward-backward movement of the TMJ. And this is going to become a crucial part of how the horse performs, or the compensation that he has to have. We ask him to. So we'll get into how these issues create a problem for him doing his job, and how maintaining the balance of his mouth can greatly improve that. Now, when we get to the point where we have this imbalance in pressure, a lack of range of motion, and change in pressure of the joint in relation to the front teeth, then we need to make enough of a change to grid and side-to-side movement of the jaw, the full range of motion of the TMJ, in order to encourage a more even wear and eruption. So when we're floating their teeth, it's easy to imagine that we're just grinding all of the teeth level, and really what we're trying to do is reduce the portion of tooth that naturally should have worn away on its own, that was unable to due to change in head position, grinding and wear of those teeth. So what we want to do is portion of the mold to of those teeth that have been worn too short. If we're able to restore the long hooks and high waves, the points of the wave, to a more natural height, then we can take the pressure off the points that have been worn too low and allow those teeth to erupt back to their natural height. Because the horse can now move his jaw forward, backward, he can change the pressure points of abrasion when he's chewing. When his jaw goes ahead, we get more natural realignment of those teeth. When his jaw comes back, we find a different point of abrasion. that's allowing these sharp edges to start to wear more evenly, where that horse still has a sort of a rough, gritty surface to the teeth to grind with, but not to the point where his jaw is getting kind of locked up and losing his lateral and forward-backward range of motion. So when we need to make large corrections like this, we want to reduce it enough to let that range of motion be reestablished, but we can only do so much at once without compromising the chewing function and the health and integrity of that tooth. The same thing will happen when we make a correction with those incisors. I think there's a lot of fear around making any change to the chewing surface of the front teeth. So one of the common questions that I'm asked is, how can we grind their teeth and not do damage to it, exposing some blood supply or nerve of the tooth? And I think what is crucial to understand is that those horses' teeth are gradually wearing away on the surface and erupting. The blood supply inside of that tooth will actually rate of the eruption of the tooth. It's a nice, even, sort of safe buffer surface and the vitality or blood supply of that tooth. So a horse's tooth does have a pulp. It does have a nerve that will run up inside of that blood supply with the horse's awareness of pressure. Also help the body determine how fast to change the bone and the cementum inside to keep the natural eruption rate and wear pattern. So there is a safe layer of tooth that can be reduced without getting too close to pulp. Now, understanding the anatomy of the inside of it at stages, life stages of the horse is what helps us make that safe judgment. We can reduce at one time without going too far, damaging the health of the tooth or surprising the horse's chewing ability. So depending on the life stage of that horse, we can make some considerable changes to motion and without being into this zone. Understanding that naturally, if this process has been allowed to go on for several years, there's going to be considerable change in the balance of pressure in their mouth, and we can't correct it all at once when that's been going on for a long time. Teeth and encourage a more natural balance, reduce enough to allow those short teeth to come erupt back to their natural height. And with several corrections, with shorter time in between, we can gradually restore that nice, even chewing surface and balance of their teeth. So when we talk about changing the incisors, we're not so much concerned about shortening all the teeth as changing reducing the naturally should have worn away. A horse had full natural. With those, the longer portion of tooth that's excessive and too much height as full movement of the jaw, and we're encouraging that natural angle of the molars as well as balance of the incisors. Okay, I gotta check, make we're not skipping any points here and load me with information all at once. A little now about how to make a plan to maintain this balance of your horse on their life stage. So well, that's going to lead us to the performance, how the dentistry affects how they go when you ride them. But when we talked a little bit about the caps on the horse's teeth when they lose their baby teeth. Now what I recommend most often is that we do the horse's first dental checkup, usually going into his 2-year-old year, prior to being started under saddle and before we have anything in his mouth to manipulate those tissues. But there's common misconception that if there's sharp points along the teeth, that if we don't put a bit in his mouth and only ride him with a halter or a hackamore, then we won't cause any tissue damage. Now, like we said before, that overlap of upper molars, 1 second here. This is our 2-year-olds. Probably this skull would demonstrate the age that most of our horses, performance horses, are started. So we could tell the upper teeth overhang this ridge here and here, how much the upper molars can overhang the bottom when that jaw is at center. So there's never really any with those cheeks against these edges. Sharp points are developed and we get that corrugated surface that we talked about. So soon as the horse feels pressure on the cheek from the outside, it's going to push the cheek up into that sharp point along those upper molars. So even starting our colts in a halter or a hackamore can cause some abrasion pinching on the outside. So we recommend that we bring those horses in for their first in that 2-year-old year, and it's amazing how these edges can get in our long-year-olds, even in comparison to a 10-year-old horse. Often these little guys are significantly sharper on their edges, their chewing surface is staying fairly level. That will be due to the fact that the enamel in their teeth is hard, but the cementum and dentin aren't quite developed as much as it is in an older horse. The older they are, the harder their intersubstance of the tooth. Braided edge happening to these upper and lower molars, and even before a bit is put in there. So we also want to check to see if that horse has a wolf tooth. Like we talked about earlier, this little tiny tooth in front of the first molar is in a position where the movement of the bit can put enough pressure on it to fracture that tooth. So we need to keep in mind that while we're on our horse, his head is raised roughly around wither height, and that means that his jaw has slid backwards a little bit. That's a position where movement of the bit can bang right against it. We need to keep in mind too that when we look at a skull, it looks like a big wide open space for your bit to ride along the bars of the mouth. But once we have tissue in place on a live horse, I'm going to put what would be his tongue in here. Now he can't quite close his mouth, but what we see of their tongue when they stick it out and they're licking their lips is quite a thin, flat shape. But about at the same point that these molars start, the tongue becomes more crested and quite high. So when if we were to look at it from a side view, let's put him here. At the front of his mouth, would be quite shallow. About at this level here, we see this rise. And the further back the tongue goes, it's considerably larger. Now, our bit is going to sit about in this position in relation to his tongue. And so with that tissue in place, there's really not a lot of room in here between the roof of the mouth and the higher spot of his tongue, right behind your bit, for that bit to sit. So it doesn't take much at all for there to be some connection of the tissue against that first molar and enough pressure from even just a snaffle to cause fracture of those wolf teeth. So that's why we generally take them out before they're ridden. When in the horses that we see that are ridden with their wolf teeth still intact, it's very common for there to be a fracture above the gum line. So now that tooth can wiggle around and is loose, but the tissue is still holding it in place. So that's what can cause a lot of discomfort in our colts that still have their wolf teeth there. Aside from the fact that the point on these little teeth becomes very sharp, and just the movement of the cheek tissue up against that sharp corner is enough to cut them with a little bit of pressure from the bit. Second of all, we talked about the caps shedding. So there will be a fairly solid deciduous baby tooth on this first molar in the spring of their 2-year-old year. By the fall of their 2-year-old year, anywhere between August to December, we often see this first cap shed. So we could see on our other skull earlier how much those little teeth can wiggle when they start to work loose. And so even some tissue pressure up against those teeth with that sharp point wiggling is enough to cause a lot of pain in their mouth. So what we generally do is check them on a 6-month basis between the age of 2 and 5, at least 2 and 4, so that we can ensure that the caps are shedding when they're supposed to. There's not too much tissue damage to the tissues as those caps are shedding, and keep those colts comfortable. It's often in our performance horses, by the fall of that 2-year-old year, we're expecting a lot more out of them in their training process. So we have more contact on the bit. We're asking them to travel in a more correct frame. And it takes more communication, contact between the bit and between our horses and our hands by use of the bit. So we're starting to see more pressure on their mouth going into that 3-year-old year. We can see on this little cap that we took off this skull earlier, set him down. When this cap is in the process of working loose, there are still some very sharp little points that are sitting up against the gum that haven't been dissolved as that permanent develops. So when this tooth starts to wiggle a little bit inside their mouth, and even a little bit of pressure of their tissue up against that tooth just from pressure of the bit, can cause those sharp points to wiggle along their gum line. So ensuring that this cap comes off when it needs to is going to help that horse just prevent that little bit of discomfort from that tooth wiggling. Now, we'll sometimes see that this cap won't come off when it's supposed to. That's going to prevent the permanent tooth from erupting properly. And two things generally happen when that's the case. It will either prevent the tooth from erupting so that it has nowhere to go, so it starts to cause excess pressure on an upper molar, will cause excess pressure into the sinus cavity. So their frontal sinus is sitting right above these first 3 molars in their, between the age of 2 and 4. And there's a very thin layer of bone. We can't quite see on this skull here, but a very thin layer of bone inside between those developing upper molars and the sinuses. So when we have entrapment of a baby tooth, it doesn't come off when it needs to. It can cause the permanent tooth to travel upward, break through that little bit of bone, cause some nasal discharge, and lead to some often some sinus infection from excess pressure. On the lower molars, we'll get an enlarged lump in their jaw, and can often, to the point where the root of that developing permanent tooth can start to communicate with that very thin layer of bone in the jaw. And on radiographs, we've seen evidence of that root of that tooth poke right through the bone in this in a young horse. So ensuring those caps come off when they need to is helping those permanent teeth come up where they should. The other thing that often happens, especially with the 3rd molar on this horse here, would be his 2nd cap. In the case where this 3rd cap is ready to shed, we already have a permanent tooth in front of it. The back 3 molars come in as permanent teeth. So we have 2 permanent molars holding this little cap in place. And often it doesn't come off when it should. And that will cause the permanent tooth to come in beside the baby tooth. So now once that cap eventually does shed, whether we help it come off or it's prolonged in that natural process, we now have a permanent tooth out of alignment with the rest of those molars. That's going to cause an issue throughout that horse's life, because now we have a misalignment of wear and eruption against that tooth. If this is our first molar and the second molar behind it is out of alignment, it's going to stick out over here. And even if the jaw has full range of motion side to side, this sharp point is never worn away. So now we have a large, sharp enamel ridge that the horse naturally can't wear away. That ridge will get higher and higher to the point where it can actually bump up against the roof of his mouth and cause a lot of pain, and definitely create some performance issues. So definitely in those first couple of years of training, doing a 6-month checkup on those colts just ensures that everything is erupting when it needs to, and that we can keep these sharp edges along these upper molars from causing trauma to their cheeks. We're going to talk a little bit about a bit seat in a minute as well, and the things that we can do to help keep their cheek tissue more comfortable by dressing and rounding these edges. As far as a treatment plan through beyond the age of 5 years old, once we have that horse's mouth balanced in his younger years, we've been doing some regular checkups on him up into his 4-year-old year. We can maybe go a little bit longer than 6 months in between floats, but generally when we go longer than a year, we're allowing this uneven wear pattern to develop, this lack of wear of the incisors that we talked about. And even if it's at a small degree where we have some small points at the back of the mouth not being worn away, little corrugated, serrated edge to those upper molars, and a little bit of interlocking of those teeth, when it's not too severe at a young age and we ignore that, we're allowing that pattern to develop. 2 more years down the road, that horse is having considerable trouble with the movement of his jaw, and we're having to make larger correction at once to try correct it. So if we can take a prophylactic approach to the dentistry, we can make small corrections to keep that mouth in balance, not having to make a huge change to him that he has to adjust to. So throughout the years of 5 to 10, we're probably seeing those horses somewhere between a 6 and 9 month time frame, depending on their environment and the wear and eruption of their teeth. Once those horses are into their teenage years and we have an established even rate of wear and balance in their mouth, then we can often let those horses go a little bit longer between checkups, but maybe not having to make huge corrections, just small changes to maintain that's already established. When we see those teenage horses who have never had their teeth floated, or it's been several years in between, there's been enough time for that wavy pattern to develop, the change of pressure in the incisors and the large hooks at the back of their mouth. So then we're having to make those large corrections to change that pattern. And it often takes 2 to 3 corrections on minimum to reestablish that balance of their mouth. So now we're needing to see them more often, more frequently, to make those changes necessary to try get them back to a healthy balance throughout their mouth. Now, when we get into our late teens and 20-year-old horses, we talked about the difference in length of tooth below the gum line. So they will continue to wear the chewing surface of those teeth until they've used up all of their tooth, essentially. When we're getting close to the root of the tooth, we'll start to see a change in the enamel on the chewing surface. So I'll hold these 2 teeth here in comparison. We have our teenage horse here. I'll hold him this way for you. So the enamel that we talked about that weaves back and forth, a really thin white line, goes around the edge and back and forth, that creates the ridge on the chewing surface. That's what makes this little bumpy surface here. That enamel will run the depth of right up below the root, or sorry, right above the root of the tooth. Once we get to this level, only cementum and dentin compose the root surface. So when we get into their late teens and 20s, we see a difference in the actual chewing surface of this tooth. I'm going to hold him this way for you, it's a little bit easier to see. The enamel ridge starts to disappear, and because the cementum and dentin are softer, it actually wears quite slick. So we start to see a cupped out, dished out surface to those teeth. But there may still be some little points of enamel remaining on the outer edges that weren't getting worn away before, like we talked about. So we can see in this tooth, this one is actually an upper molar. I'll hold him this way. We can see a cupped out, slick surface on the center of the tooth with this overhanging sharp point all along the edge. Now, when we work a lower molar against the upper, we know at center now that that lower tooth is sitting closer towards the tongue and the upper tooth sits out wider towards the cheek. Naturally, when he's grinding without this sharp point here, that lower tooth would be able to go all the way across. But because of this cupped out surface, the bottom tooth gets sort of trapped in there. We start to see a lack of lateral movement of the jaw. The horse will tend to chew up and down because he's not able to grind past that little sharp point. That causes more wear and cupping out of this tooth. And we see a considerable change in the grinding function of these teeth. So in our older horses, especially the later teens and 20s, even if they've had regular maintenance throughout their life, we go back to a necessary 6-month checkup because that's a necessary time frame for these little sharp points to develop that aren't being worn away as this chewing surface cups out and becomes more slick. And that's a natural process, something that we can't necessarily prevent. It's just part of the aging process of the horse and what really determines their lifespan. So what we're trying to accomplish in their younger years is an even amount of wear of this chewing surface, which would allow an even rate of eruption, keeping those teeth from wearing out too soon. Anytime we get a tooth that's longer than it should be, so when we talked about developing a wave, for example, we have a high spot through the middle 2 teeth, causing more pressure on the upper tooth. This upper one is trying to keep up to that amount of use, so it's actually going to get used up too soon. We're going to see a faster rate of wear. So now this one has worn considerably more than this bottom one. The bottom long one almost becomes preserved because it's just working back and forth against the upper teeth. Once this tooth is used up, there is nothing left to take its place. So if this process is happening too fast and this tooth is worn too short in his teenage years, this lower molar is allowed to rub on the roof of his mouth, causing trauma to the tissue there. We have considerable restriction of the movement of his jaw. When that goes along with the chewing up and down instead of side to side, start to see feed packing in between their teeth. We get considerable damage to the gums and disease process happening. And naturally, when they can't grind side to side, they're not chewing their food efficiently. So I'm going to go back to the point I made earlier about their function of their stomach. This is kind of bringing us full circle to the saliva production and digestion of their food. So their stomach can't break their food down any more than it gets chewed up in their mouth. They can't draw the nutrients out of food that's only half chewed up. So if they're not grinding their food efficiently all the way through this entire molar table and only chewing chewing their food at 50%, they're starting to lose their condition. Often when we see a change in condition on the outside, this process inside their mouth has been going on for several years. So in our old horses, when we start to see a drop in weight, a change in their coat, and just an overall change in their demeanor, It's often due to the fact that they're not getting their food chewed up fine enough to draw out all of its nutrients. So that's why it becomes necessary to do some regular checkups on them and reduce these sharp points. If we can file this long sharp point on this outer edge and allow this bottom tooth to go past that point, we're starting to get a more grinding function out of these teeth and efficiency. But I think there's a fear that if we float their teeth on a regular basis, that on that 6-month time frame, that we'll grind their teeth away and we'll wear them out too fast. But especially in our old horses, we're not wanting to shorten all of the teeth as much as just restore the grinding function by reducing these long, sharp points. Now, this process will continue to happen all throughout their geriatric years. So the first tooth that tends to wear out would be the 4th molar on top, and perhaps the lower molar on the front, which is naturally has a little shorter reserve crown, just due to the room that they have in their jaw below that gum line. So when that process starts, we gradually see that happen in those consecutive molars over time. So we're wanting to, in our old horses, we're wanting to maintain and try to preserve what they have. We're not shortening all the teeth, but maintaining their function. Because once this process starts, we get the sharp, the sharp ridge on the side. Pretty soon, he's only chewing on the inside edge of this upper tooth. And if this inside edge of the lower one is lacking wear, it's going to get sharper and steeper. Pretty soon, this tooth is rubbing on the roof of his mouth, causing considerable pain, and then doesn't want to chew at all. This process just gets worse, and that horse's condition drops that much faster. So I think doing without opening their mouth, checking them and seeing the condition of their teeth, we can't really judge the function of their mouth based on their outside, because it takes so much longer for that process the results of that process to show up in their condition after that problem has started inside their mouth. And I think we really take for granted how high quality forage we have in Western Canada, because compared to parts of the US, the southern and eastern states that have more of a different type of grasses, coastal grasses, for example, and coastal hay, we have such a higher nutrient value in our forage in Western Canada that when we start to see that changing condition on the outside, they've been having considerable problems in their mouth, because they're able to draw a lot of nutrients out of their feed, even if they're not getting total grinding function, where we start to see a definite change in condition on the outside in the horses that are on a less nutrient feed. So especially in Alberta and Western Canada, it takes longer for that change in condition on the outside once the disease processes happen inside their mouth. So just gauging by weight and how coat is not a proper, a proper assumption of the health of their mouth. And some of there have been some horses that we've seen that look considerably healthy on the outside, maybe even overweight and slick and shiny, but have some major issues happening inside the mouth, some fractured teeth or some feed packing, very large hooks rubbing on the roof of their mouth. And by the time we would see them lose their weight, this process has gotten out of control to where it's very difficult to correct. So that gives a little better explanation on that time frame and why we want to do small corrections and touch-ups on a more frequent basis to keep the health of their mouth where we want it. So that's a lot to take in up to this point, and a lot of information. The part that everyone's been probably waiting for or most interested in is, how is this all making my horse perform better? So we'll get to that part now. This is the fun stuff. Oh, this guy doesn't fit together. This is the wrong one. We're going to put some bridles on these skulls here. So before we watch how our bit can interact with the horse's teeth, we're going to go back to the full range of motion of this TMJ. So everything, no matter what discipline that we ride our horse in, whether it's Western or English, a endurance event, a slow event, or a speed event, I think we're all looking for one common denominator, and that would be a correct frame of the horse's body so that he can engage his hind end and use himself correctly to perform most efficiently. We're asking for that in English disciplines, Western disciplines, and I think proper collection in our horses is necessary no matter what we're asking them to do. In order for a horse to collect properly, they need to have some movement through their TMJ. So like we talked about, when their head is lowered or when they break at the poll and tuck their chin, that's when their jaw will slide forward. When they pick their head up and the further the nose reaches out, that's when the jaw will slide backwards. Now, I think we'd all agree that the last thing we want our horse to do is carry its head around high with his nose sticking out when we ride him. No one wants to look your horse in the eye when you're on top of him. So in order for our horses to properly break at the poll and lower his head below his withers to achieve a round top line and a proper shifting of the weight to the hind end, the jaw needs to be able to move forward. And even if we're talking about a 1/4 inch of movement, when we consider the amount of space in this joint, an 1/8 to a 1/4 inch of movement is going to make a considerable difference in the tissues, the ligaments, tendons, and muscles that hold this joint together, as well as the cranial nerves that travel over and around this joint. We're not going to go into deep detail on the nervous system, because that will be a whole other presentation. But there are 3 main cranial nerves that are going to travel around this joint as well. So in our horses that get an abnormal wear pattern that we talked about, where we get the steep incisor ankle, wavy pattern through the jaw, that's going to restrict the jaw from the TMJ from moving properly and limit his ability to properly break at the poll and lower his head at the same time. We often see compensation in our horses, especially the older horses that are well trained and they know their job. They know that we're asking that position, so they can try to hold their head in a lowered position with their break at their poll for a little while, but they can't tolerate that position very long without some movement through the jaw. When this joint, the lower half of this joint or the entire jawbone is sort of stuck in a rearward position from the pattern developing in the teeth, then it causes a lot of pressure and pain the further that horse engages his head and breaks at the poll. So when I'm going to tip the skull this way, this a little easier to see on this one here. What we can't see on the outside on our live horses is that how this joint attaches to their skull. So the lower surface of the TMJ is this round condyle here. It fits up in this nice smooth surface here, but one of the major functions of the horse's jaw is how this high coronoid process comes up and fits right through this hole here behind the horse's eye. Now, from the outside, we can palpate and feel the space in the joint. We can put a little bit of pressure on the lower part on the jaw to check for some movement and range of motion, but we can't see how everything articulates below the skin, under all of their muscle. When we get a chance to look at a skull, we get a better idea how this all fits together. Now, these coronoid processes stick up quite high, almost as high as the forehead surface of the horse. Their muscles on their forehead attach to the skull, come through this hole, and attach to this long coronoid process here. That's what helps the jaw move side to side. When I talk about the movement of his jaw coming from this joint way up high, if his jaw goes one direction, I'll see if I can make him go sideways, he will then contract the muscle on the opposite side here. So he's pulling his jaw back to center with these strong muscles way up high behind his behind the eye or above the eye. And so all the movement of the jaw is really coming from this area, a small set of muscles on the inside of the jaw, and a few of the large cheek muscles will help close these large cheek muscles help close the mouth. But the side to side and opening movement has to happen way up here and inside their mouth. Now, when this joint is in its natural position and his jaw, can slide forward, we get a nice amount of space all around that coronoid process. As his jaw goes side to side and round, I'll try and that's considerable more motion than his jaw could make when there's muscle attachment, but you get the idea. There's some space for that large process to move. When his jaw is stuck in a rearward position, we get a very, very tight gap between this long bone and the back of their skull here. So in those extreme cases where there's a large hook at the back of his mouth, we're losing this little tooth, a large hook back here that goes up behind this upper molar and pushes the jaw rearward, it's nearly impossible for his jaw to slide forward without gapping his mouth to accommodate a little bit of space there. So if the jaw moves at all, if this high hook is bumping against this tooth, restricting the movement of his jaw, he's either trapped in this rearward position with this coronoid process pushed way back against his skull, or this TMJ has to pry apart in order for the jaw to go forward. Either way, that's a very uncomfortable position for a horse. So that starts to give us a little bit of an explanation why our horses will want to, if they break at the poll, they maybe want to keep their head high, the top of their head above their withers, or if they extend their head below their withers, they maybe need to keep their nose stretched out. And we're constantly asking for a rounded top line and flexion at the poll, a shift of the weight to the hind end. If they can't comfortably do that, they're going to find a way to compensate. So those are our two main behaviors that we start to see when we're riding them, either a rooting of the nose or an elevation of the poll. Now, when they're elevating their poll above their withers, when we're asking them to perform, it's impossible for them to round their top line and engage their hind end properly. So then we get a hollowed out back and a restricted or shortened stride in the hind end. That's going to put more stress on their hocks, their stifles, and their SI joint. Those are three hot spots that we start to see in our performance horses that come into the clinic for sports therapy and regenerative therapy. And I think they're most commonly used joints in there. Those are the ones we see the most wear and tear. Now, if your horse is reacting to some pain in the TMJ and restriction of his jaw, causing him to hollow his top line and disengage the hind end, now we have two ends working opposite each other, contributing to the wear and tear in the hind end. The same goes if he lowers his head but keeps his nose extended to accommodate and compensate for this lack of movement here. Then he's going to keep a more elongated top line but not rounded. It also becomes almost impossible for him to engage the hind end, lengthen the stride behind, and elevate the front end or the front quarters. So we see two undesirable frames of motion and behaviors in our horses just due to this lack of range of motion. I think there's many cases where we make some corrections in the horse's mouth. His teeth themselves are not too far out of balance. There's no pain through the gums, no disease process started. Maybe some sharp edges that can rub on the cheeks, but not considerable problems in the mouth in relation to the hooks and waves and things that we see. But even if the molars are staying considerably balanced and we have an excess length or lack of wear of the incisors, creating this steep angle, that steep angle can restrict the movement of the jaw as much as the problems through the molar table. So sometimes we see as this angle gets steeper and we get an excessive length of the incisors, that's going to change the pressure and movement of the jaw here. And because we're getting a little technical, but as kind of explained before, this lower molar, that the one that we tend to see get higher than normal, that will create the wave pattern that we talked about through the molars, it's the halfway point between the incisors and the TMJ. When we see some change in angle of the incisors, a lack of wear, and some change in length as those teeth erupt, but not wear off properly, and we get this high point through the middle molar here, try to hold this guy, not losing his tooth, that's going to create almost a fulcrum point between the incisors and the TMJ. And this jaw, as we get it more pressure at the front, that's going to compress the space and reduce the movement in this joint. We talked about the meniscus pad in that joint. So it's the same as the meniscus in our knee or in a horse's stifle. That pad is designed to protect and cushion this joint. Like I said, this joint is probably used more than any other joint in their body. When they're chewing all day long, all throughout their life in a natural environment, it's designed to take a lot of wear and tear, a lot of use, but stay healthy all throughout the horse's life. When we get excessive pressure from a lack of balance throughout the mouth, once we lose that 3-point balance from the incisors, the molars, up to the TMJ, we're putting more stress and pressure on that meniscus. We can see damage to the meniscus itself and arthritic changes in this joint. So I think that's where it becomes crucial to maintain the full range of motion and eliminate the restriction throughout the molars to protect the health of this joint. Once we have arthritic and disease process starting here, then we're losing some of that natural function of the jaw. That can have a counteractive result on the wear pattern of the teeth as well. So then we're putting the cart before the horse. But if we can maintain that even balance and pressure through the molars and incisors, we're helping ensure the health of this joint throughout the horse's life. That's going to lead to his performance, his ability for his jaw to move in all directions while we ride him, adding speed, adding different positions through the head and neck and all through the rest of the body, but maintaining full movement and comfort here. So those are, to me, one of the most important parts of our dentistry and our performance horses. The health side of it is definitely crucial to keep our horses going as long as possible. But when we start asking those more intricate maneuvers and manipulating their jaw when we ride them, is totally different than how they would move their jaw on their own when they're just eating in the wild. So this function and comfort of the cheek tissue becomes crucial to their performance. So now the fun part. We're going to put some bridles on these skulls here, and you get an idea of how your communication with your horse is going to be affected by their teeth. I might get you to give me a hand here, Louisa, just to, you might have to hold this guy for me a little bit. We'll see. I have several different kind of types of bits that would be common in these ones. Unfortunately, all Western, because that's all I have in my barn. But we get the idea, even with our like English tack, how this is all going to play a part. I'm going to start with a sort of a ported style bit with more of a solid shank that swivels side to side. Okay. We have a fun little video to share with you after this to show how this will correspond on a live horse. So I'll probably need you to just hold, okay, because we don't have any ears. We have no ears, we got no muscles. Just stick that right over there. But you'll probably just have to hold it there for me so that it kind of stays in place and kind of hold this up here. That'll work. We'll kind of put him from the side. So we're going to get into how we can dress the teeth to help protect the cheeks from getting pinched against the sharp edges that develop. The horse can have some sharp edges if he's just chewing because he's not going to push his cheeks farther than is comfortable. But once we put a bit in his mouth and start moving him around, we start to manipulate the cheeks, the tongue, and the tissues along the bars beyond what he would do on his own too. With this ported style of bits, one point I want to make is that the placement inside their mouth becomes really important. Often we just gauge the placement of our bit by how much the corner of their mouth will wrinkle. There can be quite a difference from horse to horse on the length of their lips. So the corner of their lip doesn't always indicate the position of that first molar. If a horse has shorter lips and we let the bit sit lower down on the bars of his mouth, that's going to change the pressure point and how this bit is designed to work. So any of our bits with that have a port in the mouthpiece are designed to have some pressure on the bars, a little bit on the tongue, but also some work off some pressure on the roof of the mouth. Like I said before, once we have a tongue in here and the tissue that sits on the palate, this bit is actually cradled between tissue. So it's sitting right up in front of this tooth, but has quite a bit of, not all this space, basically, in between here. Now, if we let this bit sit down a little lower than normal, it's allowed, when we pull on the reins, it's allowed to collapse. I'm going to kind of open him up. If we can, I'm going to get you to hold, I'll hold the bottom if you kind of hold the top open for me, like that. I think we have enough light. If this bit sits down lower, we can see how the horse's jaw gets narrower as it comes forward, and it's sitting too far forward. When we pull on the reins, he can pull his tongue back, and it allows this bit to collapse around the narrower part of the jaw here. This little ridge right on the front of their bars is actually quite sharp. The bone itself is very narrow and sharp, and there's just a thin layer of tissue over this ridge here. So if they can pull their tongue back and the bit can collapse around the narrow part, that can actually cut the tissue along the inside of the bars, often where we don't even see it, and can create quite a deep laceration there. The other thing that we need to make note of is this tiny little hole that we can see right here is called the mental foramen. That's where the nerve that innervates their teeth, it travels right through the inside of this bone and feeds the teeth on the jawbone. It comes out through this hole here to give nerve innervation to the lips. If we let these bits hang a little too low and they collapse around the jaw, it's actually pinching that nerve right along the side of the jawbone. I think it's coincidental that it's called the mental foramen, because I think when they get pinched there, they're going to go mental. So we're going to let him kind of sit right there, and I think we can kind of see how this will work. We're going to show a video of this bit on a live horse. But now that we can see how those upper teeth overhang the lowers, we're riding our horse. Let it spin around here. I think we can see this way how these cheeks stick out. When we pull on, especially if we just pull on one rein on the shank and the shank comes outward, this purchase of our bit where it attaches to the headstall can dig in right underneath this ledge created by these upper molars. Once these edges get really sharp and we get that jagged serrated edge I was talking about earlier, and we'll let these sharp hooks develop on the front of these first molars, and the bit digs in on the outside of their mouth, it's driving the cheeks into those points. So I think when our horses start reacting, shaking their head or fighting the bit and gapping their mouth, our first assumption is that the bit is pinching them inside their mouth, when often they're getting more trauma from the cheeks getting rolled up against these sharp outer edges from the bit on the outside. I'll show you video there, the second one, that will show you example on the live.
Second, please. It's a bad angle.
Oh, 1 second. I might get it to play for you. There we go. Oh, let's click to the next one.
Oh, the one where you're wearing purple?
Yeah.
That one?
I skipped on you.
No worries. Hopefully everyone can.
Sometimes the horse can get some more pressure and pinching from the outside of the cheeks, more so than what they feel from the pressure of the beak. The first one's still showing on my screen.
Oh, okay. Sorry.
Here we go.
Okay, I'm just gonna. Here we go. Hopefully everyone can hear this. If not, please let us know.
I think it's playing here on mine.
Perfect.
Even if we don't have sound, they get the idea. You guys talk about using a noseband or a cavison too, but I'll talk about that on this guy.
All right. Do you want the other one, Allie?
I'll just talk and then we'll do the other one. Okay, so I'm going to show example of a bit with a little, a shorter purchase, but has a little more gag action to the shank. So there is quite a lot of tissue on the inside of their lips and corners of their cheeks that we don't really see from the outside. They have a fold of skin inside the cheek that our bit will actually kind of put pressure up against, and that's what often gets pinched up against that first molar. Now, on this bit here, I'm going to have you hold him for me again. So we don't quite get true representation without a little bit of tissue here. This one would work without any curb pressure though, and we have quite a bit of slide to the gag. So if I pull on the reins, this bit can slide up and then back down to center. So when with the loose tissue that sits inside of their mouth on our bits that have that little bit of gag motion, that often that tissue is actually being drug up against the corner of these first molars, top and bottom. So what we do, generally do for all of our horses is apply what we call a bit seat. Now, bits, the name itself is totally deceiving because your bit is not going to sit on the tooth. What we're doing is rounding the corner and side of this first molar. So we're making a sort of a dome shape without jeopardizing the actual chewing surface. So we're making a nice smooth surface to the corner here, along with rounding the edges all along these upper and lower molars. So even if there's some tissue moving, the tongue moving side to side by the bit, it can't pinch up against a sharp corner there. Now, I'm just going to hold this a little bit like that too. With these bits that have more of a gag action, we usually have a higher point where the headstall attaches to the purchase of your bit. So similar to the other bit we looked at where that purchase was sitting right up against the first two molars and hooking underneath here, the further back we go along their cheeks, the tighter those cheeks sit along those molars. So when we have a purchase point a little bit higher here, we're actually getting more pinching further back. Because that's the widest curvature of those upper molars, it's also the tightest point of the cheek. So there's less room for some movement before those sharp edges drag against the cheeks when we get a little pressure from the outside. I'm going to slide one more bit on, and I'm going to show you the result of having a cavesson or noseband on when those sharp points are getting in the way. Let's use this one because it doesn't move much. So we'll use a common correction bit here, kind of similar to that one slide up in there. Almost.
There we go.
There.
Got it.
So then, and now we're actually, I'll probably, there, let it kind of sit like that, and then I'll pick it up in a second. First is my, I had my little, this will work. I had another little noseband. I'm not sure where I put it. We'll create a noseband here. Actually, let's just slide this off for 1 second. I'm going to put this around here first. Okay. Fit off in there. We're going to give him a nice noseband. So it doesn't matter if we're using just a general cavesson, maybe a figure 8 on our English horses, or a tie down on majority of our rope horses and some Western speed events. We're using tie down. So it's going to be sitting probably about right there. Then we're going to slide this correction bit in. I'll kind of pop it up there so you've got a little more room. All right. Now we're doing some heavy duty training, or we got some stiff competition here. We got to make things happen. So we have our noseband sitting right across over top of the first 2 molars. And then the purchase of the bit often sits right over top, overlaps our noseband or a tie down. And then we have the movement of the shank here. So when we have that loose tissue on the inside of the cheeks that the bit can push up against, but when the horse puts pressure on the tie down, or we're using a fairly snug cavesson to keep it from opening his mouth, we've already got some pressure against the edge of those upper molars. Then when our shank moves here, it can either kind of push up under this ridge or right over top of our tie down. Now, once we have some muscle and some skin and a live horse here, it becomes very snug in this point. Then with the movement of the bars, the bit on the bars of the mouth, moving this tissue on the inside, that tissue is getting pinched up against, well, really has nowhere to go, up against this first tooth. We're getting some pushing or pressure from the outside and pinching on the inside. So we're not saying to totally change your attack. You need to stick with what helps you communicate with your horse the best. But what we want to do from a dentistry perspective, and we might as well undress him.
We'll stuck here. There we go.
Good. There. Get all those out of the way. Losing his teeth too. There we go. I'll put him back in. Talk about a harsh bit, we knocked his teeth right out. Stick him back in there. So beyond maintaining a nice even chewing surface through the molars, even pressure between the incisors and the molar table in the TMJ, from a performance perspective, we could round the edges of these upper molars here, as well as the inside edge of these lower molars where the tongue would sit. So all along the inside here, we can apply a bit seat to these front molars, rounding that corner, and also smoothing these little bumpy cusps along the side of the teeth. So any of the pressure from the outside isn't going to pinch against the enamel. Along the side here is where the enamel is folding back across the tooth, and these ridges can actually become quite prominent and sharp on these rear molars, right where they're going to get some pressure on the outside from the shank. So beyond just keeping the teeth functioning properly to chew, we can help them out considerably with the comfort of their mouth while those tissues are getting manipulated. So understanding that movement of their jaw and how the tack can communicate on the outside of the mouth is going to help put those pieces together in the reaction that you're getting from your horses when you ride them. Especially when we add some speed in there, we need things to happen more quickly. We need that a immediate reaction from them, not a delay because they're reacting to pain. We want a proper reaction to the pressure that we're putting on our reins to get the result that we want. So helping them do their job more comfortably with natural function through the TMJ, even pressure through the molars, natural balance through the incisors is going to keep that horse comfortable no matter what position we put his head in. That way, no matter whether his jaw slides forward, side to side, up and down, we have an even movement of contact of the teeth, but even movement of that jaw. That's going to optimize his comfort, optimize his performance, and prolong his lifespan. So I've thrown a lot of information at you today, and I think it's a lot to absorb. So definitely worth going back and catching the pieces that you might have missed along the way. We have one more video for you to show that's going to demonstrate how those sharp points that develop on the edges can cause trauma to the cheeks, and then show you the difference between where we have applied a bit seat, rounded the edges of the molars, as opposed to those sharp points on the other side of the mouth, sort of a before and after view, and show you the difference between a molar with a bit seat and a molar without. And then that'll wrap up our presentation for today. Do we have any live questions coming in along the way?
We do have a few, so do you want to watch the video and then I'll ask?
And certainly feel free to send text or email, and any questions that come up after you watch the presentation, we'll be happy to fill you in.
All right, let me just share this video really quick, Allie.
Sure. We have a horse here that's going to show us an example of when you sharp enamel points that start to develop on the outer edges of the upper molars begin to wear and cause some trauma to the cheeks. And we can show the difference between the sharp edges and where the edges are rounded and what we call a bit seat. So we'll open her up here and we'll set her up high. We'll shine a light here. We're going to look over on this side of her cheek where all of this abrasion and kind of little laceration on her cheek is caused by the just rubbing and wear against these upper sharp edges when she has a bit in her mouth. So we can see how when their mouth is open, we have this little fold or flap of skin on the inside of their lips that we can't see from the outside, as well as this tissue in front of, along the bars in front of this tooth is soft and squishy, so they can get drug up against the sharp corner of this lower molar, as well as these little points, way up on the edges in front of this upper molar. Now we'll go around to the other side here. And once we apply a bit seat, all we're really doing is rounding the edges in front corner of that tooth, both top and bottom, so that when this fold of skin and that soft tissue gets pushed up against that tooth, there's not going to be any abrasion and pinching against those sharp corners, and eliminates any of that trauma to the cheeks, helps the horse do their job more comfortably, and tolerate some contact of the bit up against, not necessarily on those teeth, but against the tissue that can cause pressure against, against that tooth.
Okay, 1 second. All right, I'm just going to unmute Allie and then we'll get to your questions. There. That's fine. All right, Allie, so the first one, hopefully everyone can hear me. Does a slow feeder hay net help with front to back wear?
Oh, good question. I think that's, I'm glad that question came up because that's something that I'm oft frequently asked. I really like the slow feeders for the fact that they are getting to eat a little bit all day. That's increasing that saliva production and helping their digestion and helping to prevent that ulcer scenario. But the only downside to it is they're not really getting the forward-backward motion of their jaw like they would if they were grazing, because they generally like to chew off the highest point of the bale or the net. So unfortunately, we haven't quite come up with a perfect simulation of that environment when they're constantly nipping with the front teeth, which just makes my job a little more necessary. It's why I do what I do. I really like the fact that they can nibble a little bit all the time, and they are sort of using their front teeth to get the hay out of the net, but not the same way that they would be using them to nip grass. So unfortunately, it doesn't help keep the balance of the pressure from front to back, but definitely helps with their digestion.
All right. Someone said they couldn't hear me, so I'll pop on here so you don't get that weird feedback because I'm on my own computer. The next question is, at what age would you start to notice a wave happening?
That can begin as early as 3 years old. We definitely see a difference in that change of wear pattern in the horses that are grow up in a box stall in those first couple of years, as opposed to the ones that are maybe on pasture or at least eating their hay off the ground. And so as early as between 2 and 3 years old, we often see a change in the time frame that those caps shed. So sometimes with the lack of using the incisors and that forward-backward movement, we actually see the top caps come off before the bottom, or vice versa. Maybe those top teeth are shedding those caps 6 months earlier on top than they are the bottom, or it could be the other way around. And that's going to lead to a change or imbalance in how soon those permanent teeth erupt. So for example, if a horse loses his cap on the upper tooth first, actually, I'm going to say that the other way. He loses a cap from the bottom tooth before the top. That bottom permanent tooth has a chance to erupt before the permanent one even starts. By the time that permanent tooth is erupting and the cap is shed, the permanent one is already fully in wear, and then it has a head start. So that's how a wave can start earlier in those younger ages, just from a change in how soon those permanent teeth erupt. So we really want to encourage the upper and lower caps to come off at the same time, so those permanent teeth come in at the same rate and meet right at their natural height. But often in that case where the caps don't shed when they should, we might need to reduce the height of that tooth that has a head start and allow the other one to catch up, and then we can restore that even rate of wear.
All right. So awkward. That's all the questions that we have. So that was a very extensive.
Yeah, for our live questions. No, we're happy to answer any questions that come up after you get a chance to watch all the information, because there's a lot of information there for you to absorb. And I think for the most part, we covered what I wanted to. There's always something that we didn't quite get to, but I hope that just kind of gives us a little wider view and perception of what's going on under the skin for your horses, and help you care for them so they can do their job for you.
Perfect. Thanks so much, everyone. Hopefully, technology barring, this will be posted on YouTube next week, so you guys can watch it back, and if any of your friends missed it, they can watch it too. Allie Lait works out of Energy Equine, our north location, on Mondays, and Synergy Equine, our south location, on Thursdays. You can book in with her, and she also works very closely with Dr. Andrea Smith and Dr. Lisa Hill. So often when you're at the clinic, you'll see her with dueling veterinarians as well, and as well as everyone else in the clinic too. But they're often with her in the same room. So thanks so much, everyone. We really appreciate you taking the time today to learn more about dentistry for the equine athlete. Have a great night.